Company that runs St. Francis will begin testing a new form of therapy for coronavirus patients, a treatment that could save countless lives. Joining us now with more on this is Dr. Latha Dulip-Singh, a diabetes and endocrinology specialist at St. Francis Hospital. And Doctor, thanks for being with us today.
Thank you, Dennis.
So tell us about this treatment.
So this is a study, a clinical trial, a phase 2 clinical trial that has been approved to try convalescent plasma in individuals who are critically ill with COVID-19. And we are using this to see if we can study the safety and efficacy of this particular treatment modality.
How does it work exactly?
So basically, when somebody gets sick with COVID-19, their body mounts a response. They make antibodies. So what we are looking is for donors who have already tested positive for COVID-19 a few weeks ago and are at least 2 weeks symptom-free. But then we draw their blood, make sure that they have the right antibodies, and then give their plasma to the recipients who are critically ill with COVID-19.
These recovering patients, how deep into the recovery do they have to be to donate? Just a couple days after, a couple of weeks? Or
they have to be symptom-free for 2 full weeks.
And is that rather common among these recovering patients, that in 2 weeks you're okay?
Yes, because we go back, date back to testing from around the 16th or 17th of March. And, usually the symptoms in those individuals who did not, where it was mild or moderate, is gone in a couple of weeks. And so, this would be just the right period to start screening those individuals.
Where did the idea come from to try this?
So basically, convalescent plasma has been used since the 1890s for several illnesses. And as recently as about 15 years ago, with SARS, the H1N1, the MERS. So we have research supporting the use of convalescent plasma. But what drove us to do this was a study that was published from China, a case report on 5 individuals who were severely ill with COVID-19 who received the convalescent plasma and did very well. Then there was a subsequent study a week later with 10 individuals. And so that's why we decided to pursue this option.
It's really fascinating. Very briefly, when do we see results, do you think?
We should, once you give a person the convalescent plasma, one should start seeing responses within 3 to 5 days.
Good enough. All right. Dr. Latha Dulip-Singh from St. Francis Hospital. We thank you so much. I'm looking forward to the answers on this as to when it finally comes.
Thank you.
To see how this trial goes. Thank you. In other news tonight.